Well, hello everyone, and welcome to another of our COVID-19 community updates here with the City of Brandon. Again, for context, we are recording this on Thursday, August 27th. So from the city, you have myself as Mayor. Mr. Kays isn't in the broadcast today, but we have two very special guests today. Dr. Amy Frakota, once again, who is the Prairie Mountain Health Medical Officer of Health. And joining us today is Dr. Mark Cassavant, who is the Superintendent of Schools and CEO of the Brandon School Division. Certainly, we know that there's been a lot of questions swirling around. We're gradually getting used to the Code Orange scenario, and I think by and large people are figuring that out in the community with the wearing of masks and the like. And still quite a bit of questions in the community about the back to school program. So we thought using this forum, the community updates, that we would have these two professionals join us today to outline some of those. Just to outline the relationship between the city and the health authority and the school division. Certainly we have a close working relationship, certainly no formal reporting relationship. Each are their own organizations and have their own governance, but we are always happy to join together to help disseminate good, credible information, and we know that we've got the very best of it today. So without further ado, I'm going to turn it over to Dr. Amy Frakota, our Medical Officer of Health.
Thank you again, Mayor Crest, and thank you for the opportunity to be here with the citizens of Brandon and surrounding Westman. I would like to start first with sharing some statistics related to Prairie Mountain Health Region. The statistics that I'm providing are as of August 26th, and as of August 26th, Prairie Mountain Health currently had 206 active cases. In relation to the business or work site in Brandon, there's 75 cases in total, and 41 of these cases are active. As well, 20 cases at the business are associated with the cluster in Brandon. As well, there has been still no evidence of workplace or interfacility transmission. Public health, workplace safety and health, agriculture, resource development, and the Canadian Food Inspection Agency have all continued to work closely with this business and have all continued to monitor this situation. The business continues to do an excellent job and has gone beyond what is recommended by public health, with large numbers of workers isolating, and has put in place numerous protocols to further assist, such protocols as cohorting of workers, barriers, monitoring, and PPE. As well, in Prairie Mountain Health, we have had a number of cases linked to intentional testing that was related to known clusters in communal living communities. I want to ensure to acknowledge that while the number related to this does appear high, that this is a good thing, as it means that we are being proactive and that we can self-isolate cases to prevent further spread. I also very much want to acknowledge that the communities are cooperating with public health and wanting to ensure to help get their communities and region healthy. I would like to provide an update on a personal care home outbreak in Prairie Mountain Health that will have been updated by Dr. Brent Rusin today at the 1 p.m. media announcement. Preliminary investigations indicate that a previously identified case in the Prairie Mountain Health Region is in a healthcare worker from the Rideau Park Personal Care Home in Brandon. The individual did wear protective personal equipment, PPE, and is self-isolating. Close contacts have been identified, and the case investigation is continuing. This information has been shared with the families, staff, and close contacts. There have been no other cases identified as linked to this case, and the risk is assessed to be low, but out of an abundance of caution, an outbreak has been declared. Due to that, this site is moving to red or critical on the Manitoba Pandemic Response System. This means the site is putting additional measures in place to further reduce the risk to residents and staff, and will be restricting visitation at the facility. In a moment, I will just outline a little more around the definitions and what the Manitoba Pandemic Response System is referring to. I wanted to share that overall in Prairie Mountain Health, the majority of our cases are still connected to known clusters or known cases. But we have noted multiple clusters. Since I had last come on the initial briefing on August the 13th, we have noted more clusters that are not connected to one another. We've also noted more of a trend towards more community transmission. As well, there have been various events and acquisition type exposures throughout the health region, Prairie Mountain Health. These include various public gatherings, family gatherings, events where people are socializing without adhering to public health recommendations, such as not adhering to social distancing. With this increase that we have seen in clusters and the trend towards more community transmission and some other factors, which would be the increase in number of concerning exposures, the province then did make the decision to elevate Prairie Mountain Health to the restricted level orange on the Manitoba Pandemic Response System. And that led to the public health order that was implemented on August 24th. What the Manitoba Pandemic Response System is, it is a system that helps people understand their current level of risk in our province and the public health guidance that must be followed. The response system has 4 color-coded levels with easily identifiable symbols. The color-coded levels are green, which is limited risk, yellow, caution level, which means there's community transmission at low levels. That's where the province, most of our province is at. The next level is orange or restricted level, which is defined as community transmission of COVID-19 is occurring. That is what Prairie Mountain has been elevated to. And then there's a red or critical level, which has various definitions but includes a point that there are significant strains on our healthcare system. And that is what the site Rideau Park Personal Care Home in Brandon has been elevated to. Because of what we have seen in Prairie Mountain Health with the increasing trend in community transmission, the number of clusters that we have been seeing, and the concerning exposures whereby people have been getting together without adherence to the public health recommendations, we have become elevated to the orange or restricted level. And one other thing, again, community transmission, what that means is that a case is not connected to another case or is not connected through travel. We do not know where the person who has COVID may have acquired COVID. And that means there is unknown acquisition. It is unknown where they obtained that from, and that is defined as community transmission. With the orange level for the pandemic response system, public health orders were placed on our health region on Monday, August 24th. The new orders include restrictions on gathering sizes and mandating the use of masks in indoor public places and indoor-outdoor public gatherings. The public gathering size, both indoor and outdoors, has now been limited to 10 people. This does include weddings, funerals, banquets, receptions, and professional sporting activities. As well, a person at an indoor public place or an outdoor public gathering with 4 or more people must wear a mask. There are definitions for indoor public places. Those can be found on the Manitoba government website. There are some exceptions as to who cannot wear a mask. That is a child who is under the age of 5, a person with a medical condition unrelated to COVID-19, but a medical condition that could include breathing or cognitive difficulties or a disability that prevents them from safely wearing a mask. As well, a person who is unable to put on or take off a mask without the help of another person. In addition, people can temporarily remove their masks while in an indoor public place, and those can be removed only for certain specifics. Those would be if they were receiving a service that requires the removal of their mask, if they were a lifeguard, if they were needing to consume food or drink, they were dealing with an emergency or medical purpose, if they needed to establish their identity, and if they were actively engaged in an athletic or fitness activity, which would obviously include water-based activities. The key here that we may have been seeing in Prairie Mountain, though, that we really want to bring back is bringing back these fundamentals, because perhaps, as we've heard it mentioned in our province, we may have lost touch with that or lost focus with that. And with that, I know that we've heard these fundamentals over and over, but I do want to restate them. And those include staying home if you're unwell, even if you're just feeling a little unwell. Please stay home. Wash your hands frequently. Do not share items with others. Cover your cough or sneeze, and practice physical distancing. That again, is to remember to stay 2 meters or 6 feet away from people that are outside your household. Around mask use, I would like to just briefly provide a little information here as well. As you can see, we're wearing our masks here today, and it is not something that is comfortable or that we want to be doing, but there is a reason that this has been recommended, and it is now mandated in our region, and I want to share some further information about that. Wearing a reusable non-medical mask may help protect those around you. To be at all effective, the masks are to be worn properly. And at this point, these are challenging to wear. So if we are having some challenges with it or may not be following all these principles right now, please understand we are all working on this and we will continue to work forward on this. But when masks are not worn properly, they will not prevent the spread of COVID-19 to others, and they may also put the person wearing the mask at greater risk of infection. These are the recommendations on if you're wearing a mask. You should be washing your hands immediately before putting it on and immediately after taking it off. That is because if you are touching things or you're around other things, you may then introduce what you have been touching to your face and so forth. You need to practice good hand hygiene while wearing the mask. Ensure that your mask fits well, it doesn't gape, and it covers your nose, mouth, and chin. Obviously, do not share your mask with others. Aim to avoid touching your mask or your face while wearing the mask. That is difficult because they feel unusual, and that's something we all can be working on and working towards. If you need to adjust your mask, wash your hands immediately afterwards. And it is recommended do not dangle your mask from one ear or pull it below your nose or your mouth so that it is covering your chin. I would demonstrate, but that would not be a good use of the mask, but I think you have the idea there. And for more information on how to wear a mask properly, there's great information on the Health Canada website, and we can ensure that that link is available through the City of Brandon webpage. Masks can become contaminated on the outside or when touched by your hands. So again, avoid touching your face mask while wearing it. Change your mask as soon as it is damp or soiled. Well, medical masks can be disposed of following use. Reusable non-medical masks, such as what I'm wearing, must be placed into a bag or a washing machine and appropriately laundered on a hot cycle, then dried thoroughly and stored. And I would also like to share now, switch gears a little and talk about public events where people might have been exposed to COVID-19. Information about locations for events or businesses, restaurants where people may have been exposed to COVID-19 are posted on the Manitoba Health website as this information becomes available to public health through case investigations. The link for this can be found on the Manitoba Health COVID page. And you will have noticed references to this on the Manitoba news briefings about potential exposures that may have happened, including in Brandon and the Westman area. That information is provided to help people assess the risk. The risk of transmission from these locations or events is considered low, but the information is being provided so that if you were at that event, you can assess your risk, and if you develop symptoms, be all the more vigilant to seek testing if you did have an exposure at one of the public events that is being referenced. Unless recommended by public health, only individuals that are experiencing COVID-19 symptoms should go for testing. Individuals with symptoms are asked to seek testing as soon as possible once the symptoms are present, and if it's within the first 24 hours, they will advise to wait until you've had 24 hours since the symptoms started. Employers are asked to only send employees for testing if they have symptoms or if testing has been recommended by public health. I'll just share the symptoms again. I know we've heard them before, but I thought it would be helpful to mention that while I was talking about testing here. The symptoms may include cough, headache, fever, chills, muscle aches, sore throat or hoarse voice, shortness of breath, breathing difficulties, loss of taste or smell, vomiting or diarrhea for more than 24 hours, poor feeding if this was an infant, runny nose, fatigue, nausea or loss of appetite, conjunctivitis or pink eye, and even a skin rash of unknown cause. Many people may only develop mild symptoms, but others may be more vulnerable to COVID-19. Those at higher risk typically can develop more serious and even fatal symptoms, as we are aware from what we've been hearing in the news. And higher risk groups include those that are 60 years of age or older, those living with chronic health conditions, which includes diabetes, heart, kidney, or chronic lung conditions, and those with weakened immune systems, such as from cancer. Symptoms of COVID-19 may take up to 14 days to appear after exposure to the virus. And that's why if you are a contact to a confirmed case, that you are recommended to be isolated for 14 days. Again, if you experience symptoms, you need to self-isolate as soon as those symptoms develop, no matter how mild they are. And that means staying at home and avoiding others in your own household. It means you do not go to work, you do not get together with friends, you do not go out and do an errand in preparation for being at home on isolation, even though sometimes it feels like a need to do that. Please do not do that. Do not go to religious gatherings, you need to stay at home. And then you need to seek testing 24 hours after the symptoms developed, as I've mentioned there. If you test before that time, the test can be less effective, and that's why that time frame is recommended. Early self-isolation and seeking testing is very important, and we want to have that done as soon as possible to then identify contacts of a confirmed person who has COVID, and to ensure the contacts can also be isolated before they start developing symptoms and transmit this to others. This very much helps reduce the chance of community transmission. And if you do test positive, public health, again, they will connect with you. You will make a plan to self-isolate. If you are having further challenges with self-isolation, we can help connect to isolation centers. And again, do not feel that you are in trouble for getting COVID. You didn't ask to get that. You are not in trouble. And public health very much appreciates being able to work with you and trace the contacts who you may have exposed to COVID. I will take a break from what I've been sharing at this point and pass over to Dr. Mark Passavant.
Thank you, Dr. Furcoda. Thank you, Your Worship. Appreciate the collegial manner in which we're being invited to share some information today. Your mask looks like it needs to, I should get you a rider one as soon as we can. I'd like to share some information in terms of the context of some of the challenges that I think have existed with some of the messaging that has taken place in the last week. I think where the challenge lies is that the education system is certainly using 3 scenarios that have been instructed upon which we build plans for the education system directed by Manitoba Education, and the pandemic response system that was introduced last Wednesday and then implemented with the Orange Alert on Thursday. And so I just want to revisit June 1st, the mandate for Manitoba Education has directed 2 school divisions that they were to prepare 3 reopening plans. Level 1 plan, or the Level 1 scenario, was in-class learning for all. The Level 2 scenario was a blended learning model, which involved K-8s going back 5 days a week, special needs students going back 5 days a week, and grades 9 to 12 in class a minimum of 2 days per 6-day cycle. And the Level 3 scenario is the remote learning scenario. And that's where in-class learning would be suspended, and we would move to more of a teacher-led remote learning model. So as noted, and as Dr. Furcoda shared some background on the pandemic response system, last Thursday, the Prairie Mountain Health Region was placed under an orange alert within the pandemic response system, and there was 2 measures that were added. One was mandatory masks in public, and the limited gatherings of 10, both indoors and outdoors. No other measures were implemented. So what does this mean? It means that the Brandon School Division is continuing to implement our Level 2 scenario, which is a blended learning model where K-8 students go back 5 days a week, special needs students go back 5 days a week, and the high schools, the grades 9 to 12, will go back to 50%, where A to K go back 1 day, and L to Z will go back another day. In this environment, the teachers will prepare a 2-day lesson plan where they'll do direct instruction with the students on the 1 day, and then they'll be given seat work that they can be doing at home the 2nd day. It's really important that the public and our staff continue to understand that the education plan is fluid and it can change at any time. As we have been instructed to do since June 1st, we've been preparing for these 3 scenarios, and we're continuing to do so. As of today, we're continuing to operate as if we're implementing the Level 2 blended learning model. I hope this clarifies some of the confusion. I do get that there is some uncertainty around the colors when you look at the one system that health has introduced and the government has introduced, has 4 colors, but the 3 education scenarios fit in with those colors. And if you can just keep that in mind when you're reviewing and hearing things in terms of changes, it might help to sort things out. In terms of public health orders, hand sanitizer will be available at entrances and exits of our schools and in all classrooms. Cleaning solution will be available in all classrooms. High-touch surfaces will be cleaned throughout the day. We're asking staff to stay home if they're ill. We're asking students to stay home if they're ill. We're encouraging parents to have backup plans in these situations. All staff in the Brandon School Division are being requested to complete the Manitoba Workplace Safety and Health certificate that really works on a lot of these public health measures before we go back to work and receive students on September 8th. And I'll turn it back to you now, Dr. Fukuda.
Thank you, Dr. Cassavant. I did want to add some further points to that and expand on some items that had just been shared. We do expect to see cases in the school, but we do not expect to see people going to school unwell. If any symptoms, even if only feeling a little unwell, again, staff, students, teachers are not to go to school. As well, public health will lead the response and management for all COVID-19 cases in schools. Public health will not be leaving schools on their own. Public health will be supporting the schools. As Dr. Cassavant had mentioned, Manitoba Education has been working closely with public health officials as they've been working with school divisions to develop back-to-school plans. This work will continue when children go back to school, and public health officials in school will work closely to ensure teachers, students, and staff stay healthy. The pandemic response system that I mentioned with the 4 different colors is intended to provide direction to the public. Again, that is to the public on steps that they can take to reduce their risk of COVID-19 in the community. In addition to this general guidance from the pandemic response system that is for the public and at the community angle, different sectors such as education may develop additional plans or steps to take site-specific considerations into account. And that is why it has been outlined, these steps that the Brandon School Division has taken. So the education system has done this, and they have developed specific plans or steps for their school to address COVID-19. Their system outlines additional steps for the school to take to ensure the safety of teachers, students, and staff. Public health officials have worked closely with education officials as these plans have been developed for schools this fall. And at this time, public health is very comfortable that the plans schools will be taking will help reduce the risk of COVID-19 in schools. The plan that Brandon School Division is sharing, that is not at all in opposition to public health. That is supported by public health. It is not at all in opposition to what has been shared with the orange level pandemic response system. This is in alignment. If the situation changes and public health officials feel further changes are needed, that will be discussed and they'll provide advice to the education system, and any needed changes will then be announced. Thank you. I will pass this back again to Dr. Cassavant to discuss some items around masks.
Thank you, Dr. Furcoda. I would like to just pick up, there are regular scheduled meetings that are being held between Dr. Furcoda and the CEO of Prairie Mountain Health and superintendents in the Southwest region. So, you know, we feel confident that we'll be continuing to be able to get information that we require and get answers as quickly as we can in this working relationship that we have established. I'd like to talk a little bit about masks for children and staff. We have masks for all students and staff in the Brandon School Division. The government has generously going to supply masks. I'd certainly also encourage parents to consider sending their own masks with children. I think if you can find masks that properly fit your children's face, that's really important because, as Dr. Furcoda has noted, there's certainly some contaminants that can take place with people touching their face in a continuous manner. But there will be masks available. Manitoba Education has mandated that masks are mandatory for all grades 4 to 12 students, and so that's certainly what we're carrying out in our Level 2 planning, in our blended learning model. The Brandon School Division will also require, we have some situations in the Brandon School Division where we've got multi-age classrooms where some grade 3 students might be with some grade 4 students in the same classroom, and we will be mandating that those children also have to wear them when they're in that environment in a multi-age classroom. Other children in our school division will also be able to wear masks if the parents so choose to have them wear them. Masks are mandatory for all children if they ride the bus. In terms of, I'll pass it back to you.
Okay, perfect.
Dr. Furcoda.
Okay, perfect. Yes, I'll share a little more again about the masks. As mentioned prior, in the Prairie Mountain Health Region, masks are now mandatory at indoor and outdoor public gatherings and in indoor public places. These recommendations apply to Manitobans over the age of 5. However, masks will only be mandatory in classrooms for children in grades 4 to 12, and that can seem confusing and wonder if somehow that is not in alignment, but this is based on a number of factors, and the school in Prairie Mountain, the schools are being asked to follow the mask use guidelines for classroom settings at this time. And that is why for the schools, the masks will only be mandatory in classrooms for children in grades 4 to 12, unless there's a split class, such as has been mentioned by Dr. Cassavant, such as a grade 3-4 split. Okay, and I'll pass it back again to Dr. Cassavant.
Good, thank you. I thought I'd share a little bit of information in terms of messaging that might occur through public health notifications of COVID-19 cases in schools occurring. So we're collaboratively working with Prairie Mountain Health as we speak, as well as the province, on creating protocols for if and when a situation occurs in a Brandon School Division school and or work site. And so those will be available for us before the start of the school year, and we're looking forward to continuing that working relationship with that regard. Other health orders could be implemented as a result of any cases in any one of our schools. We're fully aware that that could happen, and we certainly want to continue to remind staff and parents and students that they need to be prepared that change could occur throughout the school year. Our reopening plan has 3 scenarios, as I noted earlier, and they're fluid, and we are expecting that as the school year unfolds, we will have to continue to make adjustments. I ask for people to continue to be patient as we work through these scenarios and health orders, and to always be kind to one another. I'd also like to note that we received a number of questions from Star FM that was getting questions sent to the radio station yesterday. We're going to respond to these questions in writing and post them on our websites under frequently asked questions, so that all the public can benefit from getting responses to those. And I believe that the city is also going to link their COVID site to our frequently asked questions on both of our websites. So once again, I'd like to thank the two of you for the collaboration that has taken place today and how we continue to work moving forward.
And I'll just share a few items to add to that about when there is the messaging for public health notification of a COVID-19 case in the school. And when that does happen, public health will be notified of a positive test result. Then a public health investigation takes place. This includes the identification of any close contacts. Public health officials then notify any close contacts that they need to self-isolate for the 14 days after their last contact with the case. Public health officials will also notify the school of the case if the person was in the school during their infectious period. And public health will provide guidance on recommendations the school may need to take. As well, public health will ensure to work with the school to share information with the staff, parents, guardians, caregivers, and on the pandemic response system. In conclusion, I would want to say again, as Dr. Caspin had said, to remind ourselves to be kind to one another and realize we are all in this together. As well, in regards to stigma, this does not have a place in our pandemic plan. It adversely affects what public health is doing. It decreases the likelihood for people to be tested, to work together with public health, to share about potential exposures. And we need to be able to work together on this to decrease the risk to one another from COVID. As well, there is no place for judgment or shame to those who have contracted COVID or recovered from COVID. And in addition, there is no judgment or shame towards where one lives or works. We need to be kind to one another and work together through this. I'd like to say thank you. Thank you to my fellow Westmount and Brandon citizens for all that you're doing to follow the fundamentals. And if we've begun to lose focus, if we've lost touch with these fundamentals, please return to following these to help stop the spread of COVID. In Prairie Mountain, we are now required to wear masks and to reduce our gathering size. Please follow these orders. If not followed, enforcement, which can include tickets and fines, can be applied, although this is not the first route that we want to follow. These are challenging times. These are unprecedented times, although we can all make an individual difference by our own individual actions. Please, again, do not go out while you're feeling ill. Practice good hand hygiene, physical distance from one another when you're not with those in your household. Reduce your public gathering size and wear your masks. And to reiterate around education again, the pandemic response system that the province has introduced, that is to provide direction and guidance to the public. Different sectors have developed additional measures to take within their own sectors. So the Department of Education, the Ministry of Education system has done this and developed these specific measures for school. These are not misaligned with the pandemic response system. They are just different how they have been introduced, but we are definitely in alignment here with what health has been advising and with what the schools in Prairie Mountain Health are working on with their school plans. We are very grateful for the collaboration and connection that we've had with education. And I will pass that back then to Mayor Crest. Thank you again.
Well, thank you very much to Dr. Amy Ferkota and Dr. Mark Cassavant for extremely fulsome presentations on a great deal of information. Certainly, it would be my view that in an emergency such as we've been enduring with the pandemic, it's certainly the highest time for teamwork and collaboration. And so you can see by today's presentation and that we've got the municipality, the health authority, the education authority, really all working together. You can see the tremendous work that continues ongoing basis, especially between the education sector and the health sector, to stay in lockstep with one another to make sure that the measures are in place to keep our community safe and keep our families and children and teachers and everyone that works in the school system safe as well. So I really appreciate the level of work and cooperation that is going on there, and the willingness to come forward and provide as much information as possible. As Dr. Cassavant indicated, they are trying to respond to the individual questions, and there was a very thoughtful list provided by Star FM earlier today, and all of those answers couldn't be provided by the time we did do this broadcast, and they will provide the answers to those and many other questions on their FAQ site on the Brandon School Division's website. The City of Brandon, as soon as we can, will be providing a link on our site among the other resources that we have provided for COVID-19. Just a comment about masks. You'll notice that I had started out with a kind of a neutral gray mask at the beginning of this broadcast, but due to my larger than normal size nose, I was discovering that it was not easy, it was not a good fitting mask, and so I flipped over to my trusty blue bomber mask, and that was certainly not a shot at Dr. Cassavant being here, as he's a Rider fan, but it does fit better, and I will be using it until my Brandon Wheat King or Bobcat or another local one does show up. Another comment on masks. Anecdotally, we are getting a fair number of reports of mask littering. Now, of course, we certainly do not condone littering of any sort at any time throughout our community, but at the moment, particularly on the focus on masks. And I'm not really understanding why people would feel compelled to take off their disposable mask and just throw it kind of anywhere on the ground. So please do a better job of disposing of your mask should you decide to dispose of the disposable ones. Dr. Fakota earlier did lay out the proper procedure by putting it in the bag and then properly in the trash. They are not to go in the recycling stream of our waste collection either. Please make sure that they get in the trash, not in the recycling, and not on the street. So ladies and gentlemen, certainly lots going on. I really truly believe that our community once again are wrapping their arms around this and doing all of the fundamentals again, including now the addition of wearing masks. We had really tamped this pandemic down and flattened the curve in the early stages. As you'll recall, I'm extremely proud of our community having gone about 70 days straight without any cases. Well, now we're back to the point we need. When I mention teamwork, well, every one of you are on the team as well. So now is a time that we need to bear down, keep our nose to the grindstone here with all of the fundamentals, as Dr. Fakota pointed out, especially the wearing of masks, hand sanitizing, physically distancing, and staying home if you're ill are certainly the top ones. These gathering sizes, certainly very important right now. Sorry to say, we just may have to rein in some of the things that we would love to do for a little longer, but so very important to flatten this curve once again in our community. I believe we're heading in the right direction, and that's at the hands of every one of you that have been pitching in, so please continue to do so. So we will be back as a city on Monday, August 31st for another one of these updates to continue to keep people informed. In the meantime, continue to be safe. Practice all of those personal precautions that we can all take to help one another and keep our community healthy. Be very vigilant. Be patient, as was pointed out. Lots of information coming out and evolving, and we just have to be patient about that. And last but not least, be kind to one another. That's the only way we're going to get through this. Thank you very much for staying abreast of this very credible and important information, and we'll see you next broadcast.